going to be your host for this evening, and I'm the Senior Vice President of Education, Support, and Advocacy for the Crohn's and Colitis Foundation. And I'm really thrilled that you all could join us because I know we're all dealing with everything that's going on due to COVID-19 and all the changes and disruptions that have happened to our lives. So I'm hoping tonight's panel will be educational, informative, and lead you to some resources that may be helpful as you're adjusting and dealing with the stress and anxiety that are normal in the reality that we're living in right now. So it's my pleasure to introduce our panelists this evening. First, I'd like to introduce Dr. Tiffany Taft of Northwestern University. Dr. Taft is a psychologist specializing in chronic digestive diseases. She's part of our National Scientific Advisory Committee, serving on our Patient Education Committee. And Dr. Taft is also a member of the IBD community. Thank you for joining us, Dr. Taft. And now I'd like to, if my computer will scroll down, introduce Tina Aswani Omprakash. And Tina is a patient influencer and a blogger, and she is part of Own Your Crohn's. And I'd also like to introduce Amber Tresca, who is here this evening also as a patient influencer. And she is here my screen has literally frozen. Amber, could you finish your introduction while I fix my computer issues for a second?
Sure.
I apologize for that.
Yeah, no problem at all. I'm the founder of About IBD, and I'm also with IBD Moms, and I'm also a member of the IBD community.
Thank you so much for that. I've gotten my computer to work now, you know, technology. And that's something we're all dealing with right now in our daily lives, adjusting to meetings via Zoom and other parts of other platforms that allow us to have these communications. So I'm sure we'll talk a little bit more about that. But Dr. Taft, I'd like to get us started with a question on, can you describe the mental and emotional impact coronavirus is having on our general community? And are there any additional stressors that the IBD community in particular is feeling as they're relating and experiencing COVID-19 in their lives?
Sure, and thank you for having me for this Facebook Live event. I'm hoping I can share some useful information. This is my first pandemic, so I'm trying to apply what I know from other issues that people face to this. So there is a lot of unease and uncertainty right now. I think we're being bombarded with a lot of information, and the general community, I think it really ranges. So I'm in Chicago. I see some people that are on the chat are in New York and other areas that are being called hot spots. And so I think it's going to be different depending on where you are, the level of anxiety that you might be feeling. But if you are in one of these more urban areas, I think it feels even more scary. You know, and so we've been under, we're calling it stay at home here in Illinois, shelter in place, whatever it's being called in your part of the country, for a while now. I'd say a couple of weeks since our governor implemented that. And so people are starting to adapt to that. And now they're starting to feel the effects of not being able to get out as much, fear while going out in public places, going to the grocery store, which used to be a mundane task, is now anxiety producing. In the IBD community, especially, I think it, you know, also depends on if you're on medication that is suppressing your immune system, which I think a lot of people are, at least here in Chicago. It really adds a layer of uncertainty and anxiety. People asking if they should stop their medications, people asking if they should go to if they have an infusion, for example. All of our physicians at the major hospitals here in Chicago converted to telemedicine. They canceled all elective procedures. So even the access to healthcare has changed. So I think all of this uncertainty, I think the overwhelming feeling right now is anxiety, for sure.
Yeah. And Tina and Amber, what impact has COVID-19 had on you emotionally? And what have you been seeing in the IBD community and the people that you're engaging with all the time?
I think on my end, I know that we're all sort of used to living with some form of uncertainty with our inflammatory bowel disease. But now knowing that the whole world is living with a greater degree of uncertainty is even more unsettling because of a contagion and because this is a virus and we already have IBD to worry about. So a lot of us are feeling doubly worried. I know I am. And many of the folks that I've heard from are young, living with their parents. They're worried about how this might affect their parents, especially if they've been exposed. Others are worried, like Dr. Taft just said, that they might be immunocompromised, and should they take their medications, should they go to the infusion center? Those are a lot of the issues that I've been hearing about. Some workplaces are not understanding. A lot of people's lives feel uprooted right now. And I think for me, I've just been personally very scared of catching this virus. I myself am on a biologic and immunosuppression in general. So it is very anxiety producing. I live in New York City, in Manhattan, and just to even step out gives me a ton of anxiety. Forget about going to the grocery store, even going for a walk. There's people outside, there's kids outside, and I'm serpentining around people constantly. And it's very much like, why is the onus just on me? Why isn't everybody else socially distancing too? And I think that's been very difficult for me as well.
Yeah, I hear that. Amber, I know you dropped off briefly. Is everything okay with your audio? We're still on the question about the emotional impact this has had on you.
Yeah, can you hear me?
Yes, thank you.
Yeah, so I apologize. I didn't hear everything that Tina said, so hopefully I'm not repeating anything. But, from the beginning, people were asking about their risk and what the risk is for people with IBD. And I think we're so fortunate in the IBD community because we have such a great group of patients and influencers, and then also providers, especially on Twitter, who just immediately came together. And the foundation did a lot as well to just right away start putting everything together to get patients the answer that they needed. And, I think it's been a great comfort. I know it was to me to have answers basically right away to a lot of the questions. I mean, we're talking like a week ago, we had some deeper questions about how this might affect people and medications. And we got some really good answers from some experts in the field. And, it's interesting in how it has affected me personally, both as a patient and as a woman and as a mother. Today is my 16th day at home. I feel like that's something we're all doing on social media now, is telling everybody how many days we've been at home. And we've been managing pretty well. I've worked at home for a long time, so my day-to-day hasn't changed too much. But I will say that I do have occasions where it's a little jarring because I'll just be going about my day-to-day activities and then suddenly I'll remember, oh my gosh, my daughter or somebody will come in when I'm working and I'll be like, oh, that's right, you're not at school. That's because we have this situation going on. So it's been a little odd, but I think, most of us have been adjusting, and I'm so grateful that we have such a vibrant IBD community to help us through it.
Yeah, I really appreciate that. And I agree. The IBD community, the physicians, the nurses, the psychologists, everyone involved, every healthcare provider really came together very quickly to answer the questions. And just if anybody did miss the Facebook Live we did last week, a lot of the questions about should you take infusions, go to your infusions, endoscopy appointments, things like that, they were all addressed, and you can find those on the Crohn's and Colitis Foundation website. Today, we're really going to focus in on that emotional support aspect, but I did want to let people know if they have questions, please visit the website, and you'll find a lot of great resources there. Dr. Taft, I wanted to ask you, with the COVID-19 media coverage and the constant barrage of information our patients and our caregivers are getting, What advice would you give patients and caregivers around dealing with this constant stream of information we're receiving right now?
Yeah, I am recommending I'm still seeing patients through telepsychology platforms. So I have told all of my patients to limit their news consumption to no more than 30 minutes a day. And usually in 5 to 10 minute, blocks, right? Our 24-hour news friends repeat the same things over and over again. And if you really think about it, has the news changed dramatically? Not really. It's notification of stay in place or stay at home orders, depending on your state. It's an update on the numbers, which are going to continue, unfortunately, to rise for some time. And so we're not really learning anything new from the press. We have a press conference with our governor here every day, the mayor of Chicago, who is ready to start killing people because they keep going out here. People aren't listening to the social distancing. She shut down the lakefront because it's going to start getting warm here. Everybody's been cooped up all winter, so I'm concerned about that. So limiting your time with the TV, if you're watching news on TV, limiting your time. If you have a preferred news website, again, just keeping it to short, 5-10 minutes, getting the information you need, and then switching your attention to something else. I spend, my social media is Twitter. It's everywhere on Twitter. And so I look at it and then I step away, because otherwise, if you start feeling yourself like this, that's a good sign. It's time to walk away from the screen, whether it's your phone, computer, TV, go to something else, something that's more enjoyable, because we're not really learning a lot of new information at this point.
Yeah. And Amber and then Tina, what tips would you give our Facebook audience tonight for dealing with the onslaught of COVID-19 information, and how have you been dealing with it?
Yeah, I completely agree with Dr. Taft, of course. And I'm so glad that you said that about Twitter, because Twitter right now, if you're on sort of what they might call med Twitter, so if you're following a lot of healthcare professionals, it's pretty heavy. So I think it's really key to sort of limit that if you find that distressing. There's, you have to make that line as to, okay, I've learned what I need to know for today, and I'm not learning anything new. No, I'm just kind of like reading, maybe personal stories and things like that. And it's time to go do something else. And I think that's a great point about also your local officials. And a lot of them are having daily or every other day kind of briefings. I think that's probably a good thing to pay attention to, just because you need to know what's going on in the community. When can you go to the grocery store? A lot of the grocery stores are having hours for people who are over 65 or who are immunocompromised. Is that something you can take advantage of? Are they closing down? In my community, they have closed down the public parks and the public beaches, which I found personally distressing, but it's also really important that they did so. So it's good to just keep abreast of all of that information, so sort of what's going on and how far to take your physical distancing at this time. And it's a good idea to, I think, also to not think too much about, we have to plan for the future, but not think so much about when is this exactly going to end and what is that going to look like. I feel like there's a big focus on putting dates on things, and I get that that's necessary from for our political leaders to sort of do that, but at the same time, I think it becomes really upsetting if we get close to that date and then we end up going past that date, whatever it is. So I think it's time where we really need to draw on our inner resilience at this time, especially as IBD patients. We've all cultivated that resilience, and to distance ourselves a little bit from the news and sort of take each day as it comes right now.
Mm-hmm.
Thank you both for sharing, Dr. Taft, Amber. I think you both make fantastic points. I'm basically trying to tune in when Governor Cuomo speaks for the state of New York during his press conferences, to understand what the updates are. Like you both have been saying, I'll tune in for that half hour, 45 minutes, whatever I can handle that day, and then sort of limit my consumption. For me, med Twitter, yes, has been important. All social media has been important to get the information. But again, keeping that distance is really important, just to reiterate that. But I think more than that, I'm really trying to focus on living in the moment. A lot of us are used to, as patients, being at home, and this is really tough. It's tough for us right now because this isn't related to our disease. We might be feeling well, we might be feeling but there's something else that's limiting our ability to step out and do the things that we love. So what I'm trying to really do is focus on, the beautiful aspects of being at home. My partner is at home. He's working from home. We're spending more quality time together. I'm focusing on the sunny days outside. Yes, there's been a lot of rainy ones too, but eating meals together, really cherishing that time together, FaceTiming with friends. Yes, I have a lot of telehealth appointments, still keeping up with those, but making sure I'm making time for myself to do the things that I love at home. That means for me, catching up on reading, catching up on movies, playing virtual board games with friends has been amazing, because it allows me to catch up with friends while doing something fun on a Saturday night or a Friday night. So I think really trying to make the most of this time. Yes, it's not ideal. Yes, there's a lot of holidays coming up, but how can we sort of work with what we have during this time? And like Amber said, let that inner resilience really shine at this time. I think that's what's been very important. And just to add to that one little thing, and this is a big thing for me, I think it's been 22 days of isolation for me. I think the first week was really hard. I really needed to take that time to grieve. Grieve sort of that loss of, life, the ability to do the things that I wanted to do, the ability to go to school or, travel for some of the advocacy work I do. And I think that hit hard, and I needed to take that time to process. So I encourage you all to take that time, sit with your feelings and be with yourself during this time too, and really understand and reflect on how perhaps you'd like to really live your life once things do calm down. I like to look forward to pleasant things. So that's what I'm trying to do right now.
Yeah. The way everyone's describing all the techniques and advice is really helpful. And as a health educator, one of the things I've been seeing a lot of on the internet is a lot of information, some of it inaccurate and some of it less credible. And I would love each of you to respond on what your thoughts are and how to sort through the vast amount of information that's out there and find the good information versus the inaccurate and misinformation that can lead to more stress and anxiety. So Dr. Taft, let's start with you and then go to Tina and end with Amber.
Yes, we live in an interesting information time where basically anybody can have a platform via the internet. So I hope everybody has a credible news source that they've been going to before this even started. There are obviously differing opinions about what is a credible news source these days, unfortunately. I think the World Health Organization will always be a credible source of information. The CDC's doing pretty good. I think your local authorities, I think, I'm in Illinois, our governor has done a wonderful job of keeping us informed of what's going on. Random person on the internet, probably not a credible source unless they were before you, knew about this situation. So that kind of goes back to my previous comment of limiting your time, and going to sources of information that are useful and helpful. I think some of the messaging has been conflicting. I think Dr. Fauci from the NIH has been a good source of information. He seems to be pretty reasonable about what's going on and providing kind of hard data, but also, reasonable expectations for how long this might last. Sometimes it contradicts what other people are saying, but, I think those have been what I've gone to. And then obviously my physician colleagues and the leaders in the IBD community, so the IBD specific information, the CC, the foundation, and then the thought leaders in IBD. They're on Twitter. They've been putting out tutorials. Dr. Rubin, for example. The consensus seems to be pretty straightforward and consistent in that group too, about in terms of staying on medications and things like that. So those have been my go-to sources.
Thank you.
I think Dr. Taft did a pretty good comprehensive job of covering really the source. And I encourage you all to consider the source of the information, because just like with inflammatory bowel disease and certain aspects of that, there's a lot of misinformation out there just about the disease itself. Now with coronavirus, there's a lot of information out there. Should we wear masks? Should we not wear masks? I think in recent days, they're saying the WHO is now saying people should try to wear masks, is my understanding. So I agree, the WHO, the CDC. I also want to add the International Organization for the Studies of Inflammatory Bowel Disease, that's IOIBD.org, has some fantastic information. I believe there's physicians from around the world, IBD specialists coming together to really discuss, not just risk profiles, but what they're seeing in some of their IBD patients who may have developed COVID-19. So that's a really great source of information. And I know Dr. David Rubin is taking some information from there and putting it in his tutorials, which I know Amber and I have been pushing out into our communities via our platforms as well. Again, the Crohn's and Colitis Foundation site, I think the AGA has also been putting out some great information about fecal oral contamination as well, and how, and there's some doctors online just discussing what's going on with their patients, and if they're presenting in deep remission suddenly with symptoms, to definitely consider testing them for coronavirus. Things like that we're seeing from some of the greatest thought leaders on Med Twitter. I think that's definitely worth following. I also, with a couple of other patient advocates, reached out to Dr. Stefan Holubar as well as Dr. David Schwartzberg for guidance, because there was a lot of uproar in the J-pouch and ostomy communities. Does having a J-pouch or does having an ostomy make us inherently immunocompromised? And the answer was, from those two thought leaders, no. Not necessarily. It depends on if they're immunosuppressed. So I think there's been a lot of response to us, and I really do appreciate these physicians coming together and really tending to our questions at this time so that we can alleviate the concerns of patients in our community.
Mm-hmm.
I agree. This is one of my favorite topics to talk about ever. So I've kind of been getting in a few social media fights lately about this, which is not usually how I do things. But finding a credible source, as was already said, CDC, WHO, American Gastroenterological Association, the foundation. You can also look to some of the international associations, Crohn's and Colitis UK, Crohn's and Colitis Canada. I believe Crohn's and Colitis Canada is having webinars like every week on this topic. So there's plenty of great sources of information that we don't really need to go looking for in dark corners of the internet for information. There's plenty of good information out there. Monday Night IBD has been focused on COVID the past couple of weeks, I believe, on Twitter. Just searching for Monday Night IBD, you can find a lot of information there, and that is credible IBDologists discussing things if you want to follow that. And I would just caution that, as always, with every topic, especially with hot topics like this, there's the screenshots that float around. There's the memes that float around. And just because somebody makes a table and says the source is the CDC and then takes a screenshot and sends it around, that's not a credible source. I want to be able to see the actual source of the information. I want to see people. There's no need to take a credible source and then sort of, make a new thing out of it. You should just go to the first source, the primary source. So I agree with everything that was already said. And then just be aware that things can get spread really rapidly. Things are changing daily. So what we thought was true yesterday is not necessarily true today. Yeah. And that ties back in with limiting your media consumption, because some of these things have sort of become relevant, and then they're super hyper relevant, and then we find out that it's not really a thing, and then it kind of goes away. So just to be aware that that's also happening during this time, I think is helpful.
Yeah, no, and I appreciate all those great resources. And the one thing the foundation's been trying to do is put all of those great resources in one place, so that our IBD community can have one place to access the four societies papers or IOIBD's information. So hopefully if you are looking for that information, you can find it on the foundation's website. So we're going to switch gears a little bit. And Dr. Taft, I wanted to talk about, since we're still learning so much about the virus, and as we just talked about, that everything's changing so rapidly, what specific things are going on right now from your point of view that are causing our stress and anxiety, and what guidance can you give our patients and our caregivers for dealing with this uncertainty right now?
So the brain really likes to have solid information to hold on to and know it to be true. Whether it's true or not, if I think it's true, then I feel better with that information in my head. And so what COVID has done has really turned that whole process on its head. Some people are using denial strategies, for example, to say, well, this isn't a big deal. I don't need to isolate. I'm still going to go to the beach and have a nice time. But I think what is anxiety provoking is we're not really getting that foothold, that really secure foothold of information, because they are learning this is a new virus. Coronavirus is not a new virus type, but this specific SARS-2, I forgot the technical
SARS-CoV-2.
Thank you. Yeah. Is new. And so there's nothing on it. And I think we have global virologists working very hard. I can speak for my institution, for example. They are really working hard to try and do what we would spend years doing in the research community to get this out in weeks. And so research is a very slow process normally, and the things that we're seeing coming out is really remarkable. It may feel excruciatingly slow, but just know people are really dedicated to this and they're working on it. And so when you get a piece of information that your brain goes, ooh, that's good, it's okay to hold on to it, but be prepared that information may have to change and evolve as our understanding. So it's really being flexible when it feels not really great to need to be flexible, but allowing that, okay, this feels okay, this feels safe, this information, but tomorrow I might learn something different, and that's okay. I will adjust to that new information. We are very adaptive creatures. So just allow yourself to be more flexible in your thinking and adapt as the information comes out.
It's very helpful. And Tina and Amber, and let's start with Amber and then go to Tina. What have you been doing to adapt, as Dr. Taft says, to the uncertainty that's going on right now?
Yeah, for myself, I'm trying to accept a certain amount of discomfort, that this is a situation that there's going to be discomfort. It's going to be here. And it's maybe not appropriate to try so hard to get rid of it. Eating a lot of ice cream is not going to help with my discomfort levels, no matter how hard I keep trying to make that happen. So I'm trying to accept that, which is not an easy thing for me to do, first off, but I'm working on getting there. But we're also really busy at my house. I don't know, necessarily how everyone else is, but we're suddenly homeschooling. My husband and I are still working. We're still doing extracurriculars via video or meetings, or however we're handling it. So we have a schedule, and we've got a lot to get through every day. And I'm kind of focused on that, and I'm kind of focused on the things that I need to do to take care of myself, that I need to do to take care of my kids, to make sure that we're all on schedule. We're all drinking our water every day and, taking our vitamins, getting our exercise and getting some fresh air. And honestly, I mean, that eats up most of my day. And then I don't have a ton of time to be sitting around kind of ruminating about things. So that's sort of, the live in the moment that Tina had mentioned earlier is kind of how I've been approaching everything.
Helpful. Tina.
Yeah, no, those are great for Dr. Taft. I just want to say, for me, it's been really focusing on not just living in the moment, but spending that time. There's a lot of uncertainty right now. I think reaching out to your family members, telling them you love them, reaching out to your friends, telling them you love them too. I think that goes a really long way right now. For me, as well as Amber, I think I've just been so busy. Even during this time, I had final exams last week, projects due. So I really haven't had as much downtime as I would like. But I am really trying to take this time to focus on what it is how I would like to move forward, but also trying to focus on, if I do get this at some point in time, how am I going to deal with it? And I think having sort of a game plan, talking through those uncertainties with your family or with your spouse, partner, whomever, your parents, if you live with them, I think is really important. I think just expressing your wishes during this time, because we don't know what's going to happen. And it is a reality. We deal with it with inflammatory bowel disease. And this is a virus. So it is something that I've been trying to process and deal with as well, is just making sure that while I realize there's a lot of uncertainty, that I am taking the time out to make sure that my friends and family are okay, that I'm okay, and that I'm expressing what it is that I need for myself right now, and taking that time to do what it is that I want.
Good advice. Thank you. I do think you've touched on something, though, in some previous comments. This has come up in a few comments that everyone's made. And Dr. Taft, I'm going to start with you. The isolation, the social isolation, isn't really new to a lot of IBD patients. So many of us have experienced that due to the disease itself. But what I've heard from our community is that there is a new fear and sadness and grief being caused by COVID-19. Can you tell us more about how COVID-19 is causing these feelings and what your thoughts are to cope with the isolation, but the fear and the sadness and the grief that's come as a result of what's happened to us?
Sure. So we know that the best way to process grief is to allow the feelings to come in. We try to push away sadness and anxiety, and as was said, letting those feelings come into your psyche and sit with them for a little while before you try and push them aside. I think our reflex is, that doesn't feel good, I got to get rid of it. And so grief is a process, and it takes everybody a different amount of time to go through that process. You may have heard 5 stages of grief. I don't know how that is applied here exactly, but definitely, working towards acceptance, which is the last part of the stages of grief, can be helpful. There's going to be anger, there's going to be sadness. You may feel fine one day and then think you're on your way and feel, extremely angry the next day. It's going to be a bit of a roller coaster right now. And that's okay. That's totally normal. And so giving it its space at the table, but then also having exit strategies to get into meaningful activities, which Tina and Amber have already been talking about, diverting time in the day to meaningful, purposeful activities, which don't have to be big. I think when I say do something meaningful, people are like, oh, I better go figure out how I'm going to go climb Mount Everest or something. And it can be so small. It can be something very simple. For whatever reason, I thought I wanted to learn Japanese for a long time. I went to Japan in grad school, and there's this app called Duolingo, and I've been teaching myself Japanese. I'm never going to use it, but it certainly has been enjoyable, and I do my little lesson every day, and it's really been helpful. So something small like that is what we're talking about in terms of getting, a meaningful activity into your day. And I'm really sorry, my dog was drinking water behind me.
Well, that's a great example of our new life experience.
So I'm going to hand this off and mute my thing, Amber.
Oh, this is so funny. This is a serious topic, but wow, that was so funny. So yeah, emotions. In dealing with the different emotions, I was thinking about this today and thinking, is there emotion that I have not experienced in the past 3 weeks or 4 weeks? Really, probably not. I've put myself in timeout a couple of times, just going outside in my backyard or my front porch or my back porch, or, I like to mix it up, find a different place to go and have my every couple of day little timeout that I need to have with myself and pull myself together. But it's been also kind of a slow burn. I don't feel like there was one day that sort of everything sort of collapsed in on itself. It's sort of like this slow progression of things changing as far as our lives are concerned, and slowly things are getting canceled. School gets shut down, and then we don't know if we're going to go back to school this year. And then all of those activities, all of the spring activities, which become so important to us who live in the Northeast after the winter, all of those have gotten shut down. So it's been coping with the emotions around all of that. I think what's been the hardest on me personally, because I do work from home, it's not a big deal for me to be at home, but is not seeing my friends, not seeing my family. That's been really challenging. And so now, whenever I have that impulse, and we were talking about this earlier, Tina was, that if I have an impulse and I think of someone, like I immediately just reach out. I just, am stopping and just reaching out instead of saying, oh, maybe I'll try to talk to them later or whatever. I just reach out, see how they're doing. In some cases, there's people that maybe I haven't talked to in a little while, and we've reconnected, and that's been great. And unfortunately, every conversation seems to come back around to the coronavirus, which I don't love that part of it. But at the same time, as Tina brought up before, I've had these conversations, for instance, with my husband. What are we going to do if one of us becomes ill? Where am I going to be in the house if I were to be ill or if he were to be ill? How are we going to care for the children? What are the game plans? And for me, part of my coping with anything is planning ahead. And so we've taken the time to sort of put these plans in place. Now, they could all just, be for nothing and go to hell because everything could completely change. But it does make me feel a little bit better that we've at least discussed it, and that we know for each other how we're going to handle some of the complicated situations that we may be facing in the next couple of months.
Tina, do you have anything to add?
Yeah, of course. I think just piggybacking onto what Amber was just saying, I think it's so important right now to reach out. And yes, it's going to go right back to the coronavirus conversation. But, being able to connect with people, I think during this time is extremely important, even if that's virtually, even if it's over text, however it's done over the phone. I think just making sure that we have that, we are social beings, and that's a fact. And I think just being able to make those connections right now is so important. But in addition to that, just going back to what Dr. Taft was saying about the different stages of grief, I think I've been through all of them, whether it's anger or sadness, various different things. I've really allowed those emotions to sit. It's truly okay to have all sort of those stages of grief and sort of have that meltdown. And it's important to take those timeouts, like Amber's been saying. But in addition to that, I think, we have to be sort of proactive, knowing that we have a disease like IBD, and knowing that, there is this virus out there, that there is a pandemic out there. What sort of steps can we do to protect ourselves and our families? I think following all the guidelines that we've talked about has been very important. But as Amber was mentioning, which area of the house will we be in? For me, I live in an apartment in Manhattan, so it's not really a place where I can be isolated. And to be completely honest, and I don't want this to turn into a morbid subject, but I do want to bring this up. I did code to the flu 3 years ago, and it is something that's on my mind right now. And I think it's been weighing pretty heavily, and I've been allowing myself to feel those feelings. And so I have had those very difficult conversations with my husband. Should I need to be vented? Should I need life support? What is that going to look like? And same vice versa for him. I don't want to jump to that topic necessarily or create anxiety around it, but I think that these are topics that we do need to discuss so that we can alleviate some anxiety about what will happen or who will advocate on my behalf should something, happen in an adverse situation. So I do encourage you all, as difficult as it is, to take the time out to think about these things, and also think about what it is that you would want in certain situations, and also where it is that you would isolate yourself, like Amber said, and how we would sort of deal with the logistics of our household, and if it's parents that you're living with, how you would sort of deal with the logistics at home.
Mm-hmm.
Thank you, Tina. And thank you for sharing. I know that must have been difficult to share, and I appreciate you bringing up such a challenging topic of mortality, and but I think there are others on tonight's call that I'm sure have been dealing with that, so I appreciate that. Dr. Taft, is there anything you could add in addition around this fear that of our mortality, and planning and walking through those steps that could be beneficial to our Facebook audience this evening? I think you're on mute.
Kicked my dog out. So, so I think it's, as I interject humor as I get into that topic, I do think humor is important, and I may sometimes be a little bit beyond appropriate with my humor with my husband, but I do think it's important to have these conversations. I have a medical power of attorney. So there's a document that you can download off the internet. I've had it since before this, but if you don't have that, I suggest getting the forms for your state. I believe they're state specific, and filling that out and making your wishes known for what you would like in the, event that you are in need of life-saving care. And, making it known to at least a couple of, important people who you can name on that form, so that they can act on your behalf. And nobody wants to be thinking about these topics. I'm 44, when I was in my 20s, like, that's not something that you want to be even considering. But I think it's important to, face those difficult conversations head on, because if I choose to ignore them, it certainly doesn't solve the problem, and it actually puts me in a worse circumstance. So it's better to face that fear and anxiety. Anxiety causes us to avoid. We want to get away from whatever it is that's making me feel anxious, whether it's my thoughts, whether it's a task that I need to do. And as in psychology, we say the antidote to anxiety is to go into what you fear. And that can feel really, really scary. But, if you think about, as an IBD patient, what about all the stuff that you've been through? When anxiety is blowing things out of proportion, catastrophizing is what we would call it. I don't think people are catastrophizing right now with COVID. But the other side of that is completely valuing my strength and resilience at the same time. Thinking, there's no way I can do this. There's no way I can have that conversation. There's no way I can even think about being on a ventilator or what I would want. It's like, you can, and you probably have in the past. And if you think back on your IBD time, I've had it for 18 years. And if I think back, there's never been anything like COVID, but there's been a lot of times where I was like, I can't do this. And yet here I am on a Facebook Live talking with you. So we often think that we can't do it, and we do it. And so don't forget that, even in these really difficult circumstances, because you're stronger than I think anxiety sometimes overrides and short circuits and says you can't. And it's like, and the reality is, if you look at the evidence, you have, and you can, and you will.
I think that's a really positive note on a very serious discussion. So thank you. I do want to touch a little bit on parents who are dealing with children at home and social isolation and social distancing that's happening to them. And Dr. Taft, can you share any additional tips for our parents with IBD or parents of children with IBD that are now having their children at home and having to go through social distancing and isolation?
Yes, I have 2 children, almost 9. Her birthday's April 23rd. Oh. So we're going to have a Zoom birthday party. Yeah. So I set an hour on like 6 o'clock on her birthday where people can just do a drive-by and say happy birthday and stay on, and we'll have a cake and people can sing to her. So using the technology, a friend of mine, where I used to live, I moved, and my daughter grew up with a little boy named Joey, and we're about now 15 miles away, and we don't see each other that often. And so they're doing virtual play dates. So we have them on FaceTime. This launched my daughter into texting and FaceTime, which I try to pay attention to. And they play Minecraft, or what's that, Animal Crossing? That's super popular right now. And they FaceTime each other, and they just talk to each other while they're in their own little worlds. I'm not going to pretend to understand video games like they do. And my friend and I are like, why did it take a global pandemic for us to figure out that we could do this? Because we could have done this 2 years ago, but we didn't. And so using the technology to keep your kids connected. We live in a district that is fortunate to have resources. All the children have iPads. And we went e-learning relatively easily. I know that's not the case everywhere. They do a Zoom meeting with my daughter's class at her school. So technology, I think, has become really critical in keeping kids connected, because otherwise they just want to go to the playground and meet up with their friends, and we can't let them do that because they could get sick or they could bring something home. And then I kick my kids out and they go outside and commune with nature. And I don't live in the city, so I can let them kind of roam around in the yard and get outside, which I think is a important alternative to the screens. I think we can let go of some of those guidelines on screen usage right now. Whatever you need to do to keep your kids feeling a sense of normalcy and connectedness. And if that means they got to be looking at a screen, then I think the American Academy of Pediatrics can let that go a little bit right now. So.
Amber, as a mom, what have you been doing yourself?
So I'm very interested to know now. I'm going to go and look up if the American Academy of Pediatrics has actually come out with a statement on this. And if they hadn't, get on it, you guys, because us moms could use a little bit of a break right now. So yeah, my kids are 9 and 12. My daughter also has a birthday coming up, and you are far ahead of me, Dr. Taft. So I had better get on the ball and get something scheduled for her. As far as a virtual birthday party goes. But yeah, I have had to let go of some of the technology restrictions. My kids were not using some of the messaging tools that are available. We didn't allow it, or we only allowed it in for very particular people in very small doses. So I've loosened that restriction. I do have a little bit of concern as to when we start going back to, I don't want to use the word normal. When we start going back to, we're not distance learning anymore, we're learning in person. How do I kind of put that genie back in the bottle? Maybe we can't, but at this time, I'm letting them have the face-to-face time with their friends on their devices or on their computers, because that is helping them stay connected to their friends. And but I'm also trying to be aware of how much news and how much information that they're consuming, because my 12-year-old does have fewer restrictions than my 9-year-old, and he can get information from other kids his age. So I'm trying to make sure that every night, I don't want every dinner time to be all about the coronavirus, but we do every night just check in, I make sure that they understand how the coming day or the coming week, or now we're talking about the coming month, how that all might go, what their life might look like for the next several weeks, and what they can expect. Because routine is important, and their routine has gone completely out the window in every single way. So we're trying to keep that regular schedule up every single day. We send them outside every day. We make them go outside for like an hour. I make them get up and do stretch class with me in the morning, and they do not love me for that. And then I, keep them on their Taekwondo schedule. Our Taekwondo studio has set up classes online, which has been wonderful. I make them do their schoolwork. I make them practice their instruments. I think it's very easy at this time to just say, this doesn't matter. What does this matter right now? But it does. It still matters. It all matters. And so it's important that we keep up doing these things. And it's important that I model that behavior for them as well. So I get up in the morning. I do stretch. I do my normal workout. I go to work and I send them to school. And then we reconnect later in the day when I check their schoolwork, which they really, really hate because I make them rewrite everything. If they were at school, they wouldn't have to do that. So these are all the things that we're doing every day to sort of try to keep that sense of normalcy in a very abnormal environment. So that's what we've been doing.
Thank you. And I know those tips were helpful, even as someone without a child. Keeping that schedule and to keep your routine is so important to everybody. I have a group question, and I would love everyone's perspective here. So managing an IBD ostomy comes with additional stressors, and such as ordering supplies. And is there any additional guidance that anyone here can give our community on having an ostomy and the stress that COVID-19 and the lack of resources potentially has caused the community and how they're dealing with it? And Tina, I'm going to start with you.
Sure. So I'm an ostomate, as many of you know. So here's what I'm doing with regards to ostomy supplies. And with regards to medication, honestly, I have ordered extra supplies. I do encourage you all not to order more than like a month's supply right now, because we can't afford it. And there are people who are trying to get ostomy supplies. There's no shortage that I know of. I've spoken to a number of manufacturers regarding their supply. And while demand is high, they are still meeting their supply right now. But I do still encourage you all not to hoard at this time, like we've seen with the toilet paper, the paper towels, and the sanitizer. I think it's there's more than enough to go around, so let's just be mindful of that. The other thing I want to say is, especially for ostomates and for people with J pouches, and I'm sure Amber could speak to that as well, I think it's really important during this time of anxiety and uncertainty to make sure that we hydrate, that we stay on top of our schedule or eating schedule, and making sure that we are hydrated. That is something with anxiety and uncertainty, I know certainly myself, that I often forget to do, and I am trying to be more mindful of that. So that's been very important to me. The other thing that I just want to point out with regards to ostomies, when you are changing your ostomy device, your pouch, just please make sure your hands are extra clean. I know there's been a lot of concern about making sure we wash our hands thoroughly, but especially so before you change your ostomy, because there is that whole fecal oral route that I mentioned of contamination that we have been hearing about from IBD specialists and GI specialists in general. So just make sure before you take any pills, before you change your ostomy, whatever you're doing, make sure you stay on top of your hand hygiene during this time.
Amber, anything to add?
It's funny, the toilet paper situation. It's just, who could have imagined that we would be in this? It's bizarre, but it's very real. My husband was saying that one of those local stores does have toilet paper now, so I don't have to worry. But to be honest, there's always a lot in my house. But that doesn't mean that I don't feel a little bit insecurity that I'm like, you guys, like, maybe go a little light on the toilet paper for a little while here. But yeah, I know that the United Ostomy Association of America has been in contact with many of the major manufacturers. They have a website, they have a page on their website as far as ostomy supplies are concerned. So they are keeping an eye on if there could be any shortages, but right now they're not anticipating any shortages. And I would also say that if you're concerned about a shortage of supplies, that you should reach out on Facebook or on Twitter, on other social media. There are always people who have extra supplies, like reach out to the community if you're in a dire situation and get some help. You can also, I know the foundation has a great help center for this, a website and also a phone number. I'm sure that someone will put all that information in on this Facebook Live so that it is accessible. And for J pouches, I mean, thankfully we're not at any major extra risk unless we're receiving immunosuppressant medications. So that's really good news. Other than the toilet paper situation, which you might want to look into getting a bidet. I've been pretty lax about that myself, or if you've had a baby, they send you home with like this cool squirt bottle that you could just sort of use. Like, you might want to think about that. It's better for you anyway, because, wiping is really hard when you have a J pouch, especially when your J pouch is new. But yes, definitely, like you said, Tina, make sure you're sticking to your schedule, your diet, your hydration. It's really, really hard right now because there's like temptation to just like lay in bed and watch all these TV shows that everybody's talking about. But we have to take care of ourselves, and we have to demonstrate that resiliency in order to make sure that we're through this and we get through this as healthy as we possibly can be.
Dr. Taft, anything you'd like to say as a final word on that topic?
Yeah, toilet paper. I haven't seen toilet paper on a shelf here in like 3 weeks. Yeah.
Well, I do have some good news for you. We wrote a toilet paper tips sheet, and you can find that on our website.
I saw that on the site. I've been watching the ticker. I'm like, I gotta look at that because it's pretty. I have my and a strategy that I'm using because they have started rationing here. So like I can buy 1 gallon of milk or 1 carton of eggs, or a little late on the rationing, I think, but it's happened. So one strategy I've done is we have like a toilet paper network. So like my mom was here today and she needed bleach. And I said, I'll get you bleach if I see it, if you get me Charmin, if you see it, because she has to use a certain type of toilet paper. She's septic. So she's like, okay, deal. So like asking your friends, like, hey, if you see toilet paper and you're good, can you grab me a bag? And people will do that for you. So get your toilet paper network up. Get like 5 people that can look for it for you, because I don't want to be going to the store. Like I send my husband out periodically, but if people are out, definitely saying, hey, keep an eye out for it for me if you're good, or if they've got a spare roll, if things get real dire, they can leave one on your doorstep. So
well, and I appreciate that. I appreciate us ending on a humorous note. And although the toilet paper rationing is real and it's a scary thing for so many people, especially in our community, there are tips available. There are friends. That's the first tip. Reach out to your network to get toilet paper. And you can find that on our website. But I really appreciate each of you sharing your stories, your perspective, Dr. Taft for sharing the guidance and the helping us understand that these feelings are real and that it's a process, and we're all in learning and going through this together. And I hope everyone on our Facebook Live tonight learned something and learned a new coping skill or a new tip that they can share with their family and friends, and get through our COVID-19 pandemic in as smooth a way as possible. I know there were a lot of questions this evening, and I want to just remind everyone, as Amber said, we have an IBD Help Center. If your question wasn't answered this evening, please call us at 888-694 8872 extension 8. You can email us at info@crohn'scolidisfoundation.org, or you can chat live with the specialist. We're open Monday through Friday, 9 a.m. to 5 p.m. Eastern. So if your question wasn't answered this evening, please reach out. We'd be happy to answer your question. Speak to the gastroenterologist specialist to get anything answered that we don't already have answered on our website, and connect you with resources at the foundation or other organizations, depending on what your need is. If you have questions, as we mentioned earlier, on COVID-19, please visit the foundation's website at crohnsandcolidisfoundation.org. At the very top of the page, we have a COVID-19 resources. Everything's under there. It's really easy to find. And I really want to thank Dr. Taft, Tina, and Amber so much for their time this evening. And I want to thank all of you for joining us. And I really want to stress, if you enjoyed tonight's session and you learned valuable information, which I do hope you did, that you'll share this recording, that you'll post on your social media, and make sure others within the IBD community have access. And we know that so many of you are battling social distancing and isolation, and we're here for you. And we want to continue to serve the IBD community with programs like this, with more support services. And we know not everybody's in the situation where they can give right now, but during these challenging times, all not-for-profits are struggling. We're struggling to raise funds and continue to provide programming. So if you can give, and I hope that you'll consider making a donation to the foundation today. And we appreciate all your support. And please reach out to us if you need additional information. The IBD Help Center will be open tomorrow, and we'll be able to answer any additional questions. So thank you. Thank you again, Dr. Taft, Tina, and Amber, and good night to everyone. Thank you.
Thank you, Laura.
Bye.
Thank you.